When I had progression, I switched to Enhertu. And I feel like I talk to a lot of patients on Enhertu who have wildly different experiences with the drug. For me, it causes fatigue and nausea, and then after about a week, I feel much better. However, there are many people I speak to who don't have that experience. Why is that?
Yeah, so to best understand the side effect profile of Enhertu, I'd like to go back a little bit as to what actually Enhertu is, because it is a unique type of cancer treatment. And we have other drugs in cancer that have similar mechanisms. But essentially, to understand Enhertu is actually a combination of two things. So the best analogy is like a limousine. So we talked about the drug Herceptin, right? So Herceptin is a drug that was developed 25 years ago. It's a targeted monoclonal antibody, specifically that goes after the HER2 receptor. So Herceptin's job when it enters your body is to go after anything that has the HER2 receptor, right? But what we've developed with Enhertu is now Herceptin becomes the chauffeur in the limo. And there's about 7 to 8 passengers. The passengers happen to be this really aggressive chemotherapy. It's a chemotherapy that by itself you couldn't get because it would be too toxic. The side effects are significant. But now that Herceptin drives that chemotherapy exactly where it needs to, the chemo enters the cells and the cells around it, which is specifically why Enhertu seems to be even more effective than some of the other monoclonal antibody and antibody-drug conjugates that we've developed. But because of that, the chemo attacks the cancer and it doesn't necessarily attack normal cells. There is some overlap though. And this is why some of these side effects can be very different in different women. Some women take Enhertu and actually feel fine. And then I've had patients who've taken a couple of doses of Enhertu and have had some serious side effects from it. It is difficult today to fully predict who will respond in what way and what side effects, but understanding that the mechanism is why these drugs are different than, say, traditional chemotherapy or even traditional HER2 targeted treatments.